It's really quite bad here right now. The hospitals are basically full. The ICUs in the LA area and the Southern California area in particular are all full. The patients are now getting backed up into the emergency department. The wait times for ambulances are over 8 hours in some cases. And the really terrifying thing is that this is not even the bad time yet. It's after Christmas, after New Year, we're going to have about a 3-week lag, and then we expect another enormous surge. And honestly, the hospitals here will be on the edge of collapse.
How much can you actually provide care for people if that's the circumstances? What can you do?
Honestly, I think if the surge is as bad as we fear it could be, and maybe it won't be, maybe some of the public health measures will stop it happening. But if it's as big as some of the models suggest, we just will not be able to provide usual care at all. I think we'll have to provide a lot of palliative care. People will not be put on ventilators because there won't be anywhere to put them. And some patients that are on ventilators may be taken off them to put those ventilators onto younger patients. I really do think we're about to see something that we haven't seen in this country or in Australia in over 100 years.
How did it get so bad, Mel?
We're not really sure. We thought, like a lot of places, that we'd missed most of the worst part of this, because in California we tend to drive cars, we tend to live in homes that are sort of single generational. But it really exploded, particularly after Thanksgiving, when people, I think, had pandemic fatigue, and then they started to gather in groups again. And it's also possible that there's a virus strain like the English strain that's a bit more infectious. But I think really it comes down to multiple factors, and the fact that people just sort of started getting together again, and this thing will blow up pretty fast.
So you're really just hanging out for the vaccine, which is now starting to be rolled out in the US. Have you seen that in the hospitals that you're working at yet? Has it actually started to be rolled out to you?
Yeah, there's a bunch of the doctors and nurses are actually getting it now, which is great news. It's really quite a tragedy, though. The vaccine is rolling out, and that means that the end is near, but it's not near enough, because although the docs and the nurses are going to start to get the vaccine, big parts of the population are not going to see it for many months, 3-6 months. And this wave that's coming is only 3-4 weeks away. So it's not going to help.
And just tell us about you. I mean, you had finished your emergency doctor, you'd finished working in the hospitals, but you felt compelled to come back. What does your day look like? What does your week look like? And why did you come back?
Because of what is here, what is coming. Because, it's not a simple solution to just say get more retired doctors and nurses to come back. I actually feel mostly useless right now, because you need to know an entire system. You need to know the computers. You need to know where the medications are. You need to know the system. So mostly right now, I'm just helping out the docs that are there, helping some of the more junior physicians that are there. But I fear that in the next 3 or 4 weeks, that it'll be more about doing palliative care. It'll be more about sitting with patients as they're dying and helping them through that process, more than doing something magic like intubating patients, because there just won't be the resources.
You sound energized. You sound as though you're kind of coping with it. How are you feeling seeing this large-scale human tragedy unfold before you?
I'm terrified. I'm really terrified, and you get waves of depression and anxiety, and then you're energized. Okay, we're going to do this. It's a war. We're going to go fight the war. But it's truly terrifying. I was at work just a few days ago just to see how many young people, we think of this as an old person's disease, but to see 30-year-olds and 40-year-olds and 50-year-olds dying in the emergency department of this, it is terrible. It is devastating parts of Los Angeles, and particularly in the Hispanic community, which tends to be multi-generational, a lot of frontline workers really being killed by this terrible virus.